it's an easy process. That's why everybody wants to do it. We're really surprised at how many young males are actually doing it. I'd say actually more young males are doing it than anybody else. You know, 20 to 30. Professional students. We have somebody who is actually even on social services. Maybe I shouldn't even say that. You know, they say they really wanted to do it, and actually, you know, at first I would think so, but you know, kids are great patients, and I find that what happens with kids, I was a little leery in the beginning because our youngest patient is actually 11 years old. And she's absolutely fantastic. We have a couple of boys that are 14, 15, 16, and they do really well as well with it. Much better than I with braces, you know. So
great.
Yeah. No, not at all. Adults are just as good. In fact, sometimes the problem is with adults is that their dentition, their teeth have already been mutilated to some degree. They're missing some teeth. You know, somebody tried something else down the road. You know what? That's the idea behind Invisalign. There's a lot of young adults, 20 to 35 or so, who have always wanted braces, or when they were growing up didn't want to have braces, or their parents couldn't afford braces, but now they want to have this, but they don't want to wear traditional braces, so Invisalign is a great product for them. In the beginning, they'll only allow you to, if you want to become an Invisalign provider, you have to take their course, okay? Then what happens is you start submitting cases, and they want you to submit fairly easy cases. I think we pretty well start, I think at the moment we're starting about 5 or 6 new cases every month. Well, what happens sometimes, and a lot of people don't know this, is that Invisalign might not be the treatment for everybody, but sometimes you can start off with traditional orthodontics or braces, and then in the majority of the treatment you can go into Invisalign, or vice versa. The treatment for Invisalign tends to be shorter. Okay. Another really big plus is you're able to keep your teeth clean. Okay, with minimal amount or regular type of oral hygiene, where with traditional braces, you have to be very meticulous, you know, to keep it clean. I was quite surprised when I started. People are really, once they get their trays, they'll wear them, and it's amazing how compliant they are. Again, adults, not a problem. First thing people ask is if there's a payment schedule that they can have. Okay. Normally, what we do is we have a third of it is to be paid when the start of treatment, and then the remainder over the period of or the course of the treatment, which is usually about a year's time, maybe a little bit longer. Okay, so that's the standard payment plan. When they come in here, we'll go through the process of Invisalign, show them the actual trays, explain to them how long they need to wear, what to expect. We will also show them cases or treatment that we have done or have been done by Invisalign that's very similar to their problem. What ends up happening is actually I'm more critical than the actual patient is. So sometimes the patient's happy, but I feel that this could be done, could be finished off a little bit better. What Invisalign does, which is really good, is once you finish the case, if you're not happy or the patient isn't satisfied, they'll allow you to finish up the case with 2 more sets of trays to get to the point of where you want to be. they can still see their regular dentist, and we'll just provide their Invisalign treatment service. And when we're finished, go back to their own dentist who they're comfortable with.